Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Wednesday, December 29, 2021. Sorry about that. It's been a crazy week so far, coming off the holidays and so much going on. But it is hump day and it is Wednesday. And I wanted to come this afternoon and just give an update of COVID. I sent out an update yesterday to our local leaders, and then also Dr. DeLisi did an update on the local radio station yesterday, but wanted just to give a Facebook Live update of where we're at. And we're starting to see an increase over the last 3 to 4 days. Omicron is a new variant, and it is in our area. We don't have the ability to test on site, so when somebody tests positive, I cannot tell you which variant it is. We have to send it away. It takes 2 to 3 weeks. We have sent a couple away, but other health systems that we're friends with and talk to on a routine basis have the ability to test on site, and the symptoms that they're seeing that are positive for Omicron are the same that we're seeing here at Titus. So what does that mean? This is a very contagious disease, and it spreads 1,000 times quicker or more transferable than the Delta variant, which transported itself a lot more than the other variants before it. So from that perspective, Omicron is here in the area and it's going to spread quick. We guesstimate over the next few weeks it's going to be throughout our community, and we've seen that over the last 6 days. Our last 7 days, we've been at a 35% positivity test rate, but in the last 2 days, we've been over 55% test rate of positivity of people being tested for COVID-19. We've seen that increase dramatically. That's the bad news. Here's the good news. Omicron is not producing as high acuity patients as its other variants, Delta and the ones before. Now, with that said, please understand, Northeast Texans, including myself, have quite a few underlying conditions that could put you at high risk. We've had about 1 to 2 to even 3 patients in the hospital because of the Omicron variant. The majority of it is in the outpatient settings. The emergency department has been flooded. The clinics have been flooded. The testing centers next to the hospital have been flooded. And that's critical for you to know because it's taking its toll on our community. It's also taking its toll on our staffing. At the hospital, we're down quite a few employees because of the variant and having to look at our visitation schedules along with, do we change the requirements for coming back to work? We're currently sitting in the middle stages of the 3 stages, with crisis being the most severe stage of staffing. We're sitting in the middle right now. We're watching it closely and meeting with our medical staff. The ability for Titus to transfer out is almost impossible. We're having a hard time with very sick patients that are needing things that we don't offer here or getting them to any facilities. And I'm not talking about East Texas. I'm talking about San Antonio, Austin. We worked with Corsicana yesterday of trying to transfer a patient that needed to be outside the health system. So it's very difficult right now across all hospitals in Texas, Oklahoma, and Louisiana. And we just want to make sure our community understands that. So if you're coming to the emergency department, please be patient. The team's doing the best they can, and I applaud our staff and our doctors for the work that they're doing here at the health system. From what can you do from Omicron? A lot of it is just simply you're hearing and seeing from a symptom standpoint, you just feel bad. Fatigue, a little bit of fever. It's not much of the lung and respiratory of the other ones. So for the majority of the people, you just feel bad. We do encourage you to see your primary care physician. There are things that they can give you to help with that and reduce it. Some other things that I encourage you is mask. Please mask. That's one of the things that we can do is reduce the spread, mitigate the spread, is mask. Wash your hands. Wash high-touch areas. Consistently clean those areas. Social distance. If you can't wear a mask when you're drinking or eating, social distance to the best of your ability. And the last and probably the most important is get vaccinated. The vaccination is having a tremendous impact on the Omicron variant. Very few vaccinated people are getting sick at all. The majority of them don't even know they have it. And the viral load for vaccinated team members or vaccinated patients is very small. So they're transferring it at a less rate than the unvaccinated on the things that we've read. I compliment and applaud our medical staff, our physicians, Dr. Frederick Thurman, and the rest of our COVID physician team on the work they're doing. They're working with the infectious disease doctor, Dr. Yates and Tyler, on best practices and things we can do. But the vaccine is working, and the booster is working as well. So I do encourage you to get your vaccine, to get your booster shot. The team is open. Go to our website at titusregional.com, and you can see the process for getting an appointment and get that either first dose, second dose, or your booster shot of those. So please go to there, and vaccinations, what you can do to help the community. The other thing I want to talk about, which is unfortunate, is monoclonal antibodies. Titus Regional Medical Center has been giving these infusions for over a year now. Once it became an outpatient, we did the things with Dr. Thurman and our physicians to give the antibodies and the infusions. One of the first ones in Northeast Texas. We've been aggressive. We've given it to quite a few people. And we believe that's the reason why Titus County has the lowest mortality rate, even though we have the highest COVID per 100,000 in Northeast Texas, is these infusions. Unfortunately, the state and the federal authorities are stopping shipments of monoclonal antibodies 3 days ago. These infusions are being stopped because it does not have an impact, per the studies, on this variant. Unfortunately for Northeast Texas, even though it doesn't affect the variant, it is helping some of the underlying conditions, so we continue to do it. But with no more shipments, the antibody treatments are going to go, the inventory is going to be depleted within the next few days. So we are only giving the Regeneron and BAM treatments for high-risk patients. So if you talk to your friends who had it last week or even had it on Monday and Tuesday and you want that infusion, I'm sorry, but we're only able to give it to high-risk patients, and unfortunately in the next week or two we'll be completely out of the antibodies. So it's going to hurt us even more. So I do encourage you, if you have symptoms and you have a high risk, you are overweight, diabetes especially, heart conditions, I encourage you to go see your primary care doctor. Just because you feel bad, go see your PCP, get them started. There's some things that they can give you that will mitigate this. So I just encourage you to treat it as for what it is. Even though we say it's less acuity, there's 1, 2, and 3 people who are going to die from this. And I encourage you and your family members to take it serious, even though we're not seeing the acuity. So I know I'm talking out of two sides, and I know it's not what you want to hear as we go into New Year's. We have to continue to live our lives. We can't be scared of the COVID and the different variants. However, we can be smart in the things that we can do. Get vaccinated, social distance, and mask. If you're not vaccinated, wear a mask, social distance to the best of your ability. And if you're not vaccinated and you start showing symptoms, seek help immediately to ensure you're not one of those who has the severe things. The other thing I just want to bring up and just say Happy New Year to everybody. And I'm sorry I come on here and be the Debbie Downer or the person who was always with some of the bad news, but we want to make sure we're being transparent to our community, and we're trying to help our community in any ways possible. And we are going to encourage the vaccine. We are going to encourage masking. But as we celebrate tomorrow night, and Friday night, just want to thank everyone. Thank everybody for your support of our community. Over the last 12 months, 2021 has been fascinating on so many levels. It's been a blessing on so many levels, and there's been a lot of things that have been sad over this last year. We've had a lot of great accomplishments as well. And as we reflect on 2021 and get ready for 2022, our commitment to you, our commitment to Northeast Texas and this community is we're continue to do what we've been doing. Be transparent about what we're seeing. How can we improve the underlying health of not only Northeast Texas, but rural America? That's what we have to do to increase our ability to stay alive and decrease the mortality rate in rural America. We can do this, but there are things that we can work on in addition to COVID-19 and those things. So on behalf of the Board of Managers of Titus Regional Medical Center, the executive team, and the team members at Titus Regional, Happy New Year, and I wish you the best of 2022. God bless.